Has someone you love gone quiet lately, and you think it's just tiredness? On Wellness 60 to 100, we reveal how sudden silence in older adults could be an early neurological red flag. Discover how speech decline can signal deeper threats to healthy aging, long before memory loss even begins. Elaine, a vibrant 79-year-old grandmother from California, was once the life of every family gathering. Her stories, laughter, and sharp wit lit up every room. But over the past 6 months, something changed. She still showed up to Sunday dinners, but spoke less. Then barely at all. She'd smile, nod, but rarely join in. Her family assumed she was just tired or overwhelmed. But her daughter, Karen, noticed something deeper. Elaine struggled to find the right words. She often paused mid-sentence, then gave up. At the doctor's office, Elaine stayed quiet while Karen answered questions for her. Eventually, a neurologist diagnosed her with primary progressive aphasia, an early-onset language-related form of cognitive decline. Her silence wasn't emotional withdrawal. It was neurological. Elaine's brain was slowly losing its ability to process and produce speech. The family was devastated, but grateful they caught it early enough to begin therapy, communication exercises, and a care plan that kept Elaine engaged. Elaine's story is not rare. When seniors go silent, it's often misunderstood. But sometimes, the silence speaks louder than words, offering a critical warning before deeper memory or behavioral issues appear. I'm Dr. Emily Carter, and I urge families to take sudden silence seriously. When older adults stop speaking as much, not by choice, but by struggle, it may signal neurological decline. Speech involves memory, coordination, and emotional expression. A drop in verbal engagement can be the first warning sign of brain changes long before confusion becomes obvious. Many families dismiss quietness in seniors as simple tiredness, shyness, or mood. But on Wellness 60 to 100, we explore why a noticeable drop in speech can actually be an early red flag for neurological decline. In this episode on healthy aging, we break down how reduced conversation may reflect weakening language centers, emotional withdrawal, or early signs of dementia. Silence in older adults isn't always a personality shift. It can be the brain struggling to keep up. Learn how to spot the difference, what medical signs to look for, and how early intervention can protect speech, connection, and independence before more serious symptoms emerge. It's easy to assume a quiet senior is simply tired, reflective, or introverted. But sudden or progressive silence in older adults, especially those who were once talkative, can be a subtle but serious warning sign of neurological changes, not just a shift in mood or personality. Speech isn't just conversation, it's a complex brain function. It requires memory retrieval, cognitive processing, emotional input, and motor coordination. When a senior suddenly begins speaking less, pausing more, or avoiding conversation altogether, it could indicate that one or more of these brain systems is struggling. Common explanations like fatigue or sadness may apply occasionally, but persistent silence, especially when paired with word-finding difficulty, hesitation, or disinterest, deserves deeper investigation. In fact, early-stage conditions like primary progressive aphasia (PPA), early-onset Alzheimer's, frontal lobe degeneration, often present with changes in speech before any memory loss is obvious. Research from the Mayo Clinic and Alzheimer's Association has shown that speech and language changes can occur up to 5 years before formal diagnosis of dementia-related illnesses. This includes reduced vocabulary, shorter sentences, and a reluctance to initiate conversations. Silence may also reflect emotional disengagement caused by cognitive overload. Seniors sometimes recognize their struggles to keep up mentally and withdraw to avoid embarrassment or frustration. This can lead to social isolation, depression, and faster mental decline. In some cases, changes in speech can even stem from small, unnoticed strokes, known as silent strokes, or early Parkinsonian signs, where speech becomes quieter, slower, or more monotone. The danger is in brushing it off. If someone who used to chat freely is now unusually quiet, don't ignore it. Observe, ask gentle questions, and seek medical advice. Because when speech fades, it's often the brain, not just the mood, asking for help. Speech is a miracle of coordination. Every word we speak involves the synchronization of memory, emotion, motor control, and language comprehension. As we age, certain brain regions become more vulnerable, especially those tied to verbal communication. Two key areas govern our ability to speak. 1. Broca's area, located in the frontal lobe. This region is responsible for language production. It helps us form sentences, find the right words, and speak fluently. 2. Wernicke's area, located in the temporal lobe. This region helps us understand spoken and written language. Damage or degeneration in either can lead to serious speech impairments. With age, these areas naturally lose neurons, but the process accelerates in those with underlying neurological changes. For instance, in early Alzheimer's disease, word-finding difficulty is one of the first noticeable symptoms. People often pause mid-sentence or substitute words unknowingly. In primary progressive aphasia, Broca's area is directly affected, leading to halted speech, mispronunciations, and eventually, inability to speak clearly. In frontal lobe degeneration, speech becomes flat, sparse, or emotionally disconnected, even though memory may remain intact. Even outside of dementia, microvascular damage, tiny strokes or reduced blood flow due to conditions like hypertension or diabetes, can silently impair these language centers. Seniors may seem physically fine but begin to struggle with coherence, vocabulary, or verbal recall. Researchers using MRI scans have found that seniors who experience prolonged silence often show shrinkage in Broca's and Wernicke's regions, as well as weakened connections between them. The good news? These areas can be stimulated and strengthened with targeted therapy, reading aloud, conversation, and speech exercises. But the first step is recognizing the change. When speech fades, the brain may be waving a white flag. Listen closely, not just to what's said, but what's no longer being spoken. Sometimes, when seniors stop talking, it's not their brain's language centers failing, it's their heart withdrawing from connection. Emotional disengagement and depression are two of the most underdiagnosed conditions in older adults, and both often manifest as silence long before sadness or tears. In clinical settings, it's well documented that older adults express depression differently than younger people. Instead of saying, "I feel sad," many exhibit a noticeable decrease in conversation, disinterest in previously loved topics, slower responses in social situations, flat tone or minimal facial expression. This quieting down can be mistaken for fatigue or normal aging, but it's often a form of psychological shutdown. There are several reasons behind this silent withdrawal. 1. Loss of purpose or role, retirement, bereavement, or empty nest syndrome can strip away a senior's sense of identity. Without meaningful connection or daily goals, they may stop engaging. 2. Fear of judgment or frustration. Seniors experiencing early memory lapses or cognitive delays may avoid speaking to hide mistakes or avoid embarrassment. 3. Chronic pain or medication side effects. Physical discomfort and certain drugs, like sedatives or blood pressure meds, can dull alertness and emotional expression. 4. Social isolation. The fewer meaningful interactions a person has, the harder it becomes to stay socially fluent. Silence often feeds on itself. One study in the American Journal of Geriatric Psychiatry found that late-life depression is strongly linked with reduced verbal output and increased internal rumination, meaning many seniors turn inward emotionally while appearing quiet on the outside. Families may notice that the person is present physically, but emotionally distant, giving short answers or none at all. This disengagement isn't laziness, it's a signal. The silence of emotional withdrawal is just as urgent as a physical symptom. Left unchecked, it can evolve into deep clinical depression or speed up cognitive decline. When seniors stop talking, ask not just what's wrong with their words, but what's happening in their hearts. Language is often one of the first cognitive functions to show signs of trouble in early dementia, sometimes even before memory loss becomes apparent. When a senior begins speaking less, using simpler words, or pausing frequently, it's more than a communication issue. It could be the brain's early distress call. In the early stages of Alzheimer's disease, the regions responsible for memory and language, especially the temporal and parietal lobes, begin to degrade. One of the earliest symptoms? Word-finding difficulty. A person may point instead of naming an object, pause mid-thought, or substitute vague terms like thing or that instead of specific nouns. Over time, other changes emerge. Reduced sentence complexity. Repetition of ideas or phrases. Increased hesitation and filler words. You know. Inability to follow conversations. This subtle decline is sometimes dismissed as senior moments, but repeated patterns, especially in once-articulate individuals, signal something deeper. In primary progressive aphasia, PPA, a lesser-known form of dementia, language loss is the primary symptom. People with PPA may understand speech but struggle to speak, or vice versa. It's often misdiagnosed as depression or anxiety due to their reduced communication. MRI scans of early dementia patients consistently show atrophy in Broca's and Wernicke's areas, as well as the angular gyrus, which integrates spoken and written language. This physical shrinkage correlates with the verbal decline observed in daily life. Moreover, language loss increases emotional and social isolation, which in turn accelerates dementia progression. It becomes a vicious cycle. Less speech leads to less interaction, which weakens the brain further. Recognizing the link between silence and cognitive decline is crucial. Early language changes provide one of the few windows for early diagnosis, treatment, and planning before other symptoms appear. If your loved one is going quiet, don't assume they're just tired. Their brain may be speaking volumes through their silence. When a senior family member suddenly becomes less talkative, it's natural to brush it off as mood or fatigue. But when silence persists, families need to shift from passive observation to gentle intervention, because silence can signal more than meets the ear. Here's what you can do to help. 1. Observe patterns. Take note of when and how the silence happens. Is it during group conversations? When recalling memories? Do they struggle with certain words or trail off mid-sentence? Write down these patterns. They can help doctors make more accurate assessments. 2. Create a safe space to speak. Avoid correcting, rushing, or finishing their sentences. This can create anxiety or shame, discouraging further speech. Use open-ended, low-pressure questions like, "What did you think about that movie?" to encourage gentle re-engagement. 3. Encourage routine social contact. Even short, structured conversations, such as morning coffee chats, reading together, or playing word games, can stimulate verbal centers. Invite others for brief, meaningful interactions instead of overwhelming gatherings. 4. Suggest a cognitive screening. Frame it positively. Let's check in on how your mind's doing, just like a physical. Many memory clinics or neurologists offer language-based assessments that can catch early decline. 5. Watch for emotional triggers. Sometimes silence masks grief, anxiety, or untreated depression. Ask how they've been feeling, not just physically, but emotionally. Consider therapy or support groups if loss or sadness may be contributing to their withdrawal. 6. Celebrate small wins. When they do speak, respond with warmth and patience, even if it takes time. Emotional safety is key to keeping communication pathways open. Most importantly, don't wait. Silence may feel subtle, but it can signal the first slide toward isolation, depression, or dementia. Early support can preserve not just language, but relationships, confidence, and quality of life. When words begin to fade, listening with your heart may be the first step to bringing them back. Ignoring a senior's sudden silence can lead to serious consequences. Reduced communication often signals early cognitive decline or emotional distress. Without timely intervention, speech loss can progress to complete inability to express needs or feelings, increasing isolation and depression. This accelerates mental deterioration and weakens social bonds. Families may miss critical windows for diagnosis and treatment. As communication fades, so does independence and quality of life. Recognizing and addressing early silence is vital to slowing decline, maintaining connections, and supporting brain health. Don't mistake quietness for tiredness. Listen closely, because silence can be a cry for help. When a senior suddenly speaks less, it's important not to dismiss it as mere tiredness. This change can signal early brain changes or emotional struggles. I recommend families observe carefully. Note changes in speech patterns, hesitation, or withdrawal. Encourage gentle, pressure-free conversations to make communication comfortable. Engage your loved one in activities that stimulate language, like reading aloud or storytelling. Most importantly, seek medical evaluation early. Cognitive and language assessments can identify underlying neurological conditions such as aphasia or early dementia. Early diagnosis opens doors to therapies that slow progression and improve quality of life. Remember, communication is key to connection and care. Don't wait until silence becomes permanent. Act with patience, empathy, and urgency to support your loved one's brain health and emotional well-being. Dr. Emily Carter. If you've noticed a loved one becoming unusually quiet, don't ignore it. Like, comment, and share this video to raise awareness. Subscribe to Wellness 60 to 100 for trusted advice on healthy aging, and hit the bell to stay informed on early signs that matter.